My part is based on zygomatic bone and the mandible. Zygomatic bone, also known as zygoma, which makes a pair of cheekbones on both sides of your face. It matures through a process known as intramembranous ossification, where it grows in size and changes shape. It differs between males and females. It is regarded as one of the most irregular bones in shape. It has 3 articulations or processes. Frontal process articulates with the frontal bone via the frontozygomatic suture. It also contributes to the lateral border of each orbit. Temporal process articulates with the temporal bone on each side via the temporozygomatic suture, forming a zygomatic arch. Maxillary process articulates with the maxillary bone via the zygomatico-maxillary suture. Zygomatic bone also plays a role of insertion for the Masseter muscle, which is one of the 4 muscles of mastification, and supports the facial tissue, pronouncing it to form cheeks. It has 3 foramina, which are the passage of nerves and corresponding blood vessels. Zygoma is the second most common area of fracture in the face due to violence and accidents. It can be diagnosed and treated non-surgically unless there is severe injury, and surgical diagnosis must be considered. Mandible or lower jaw is a singular bone with distinctive horseshoe shape, which consists of no less than 5 individual parts that intramembranously ossify together. The only bone that does not articulate with its adjacent skull bones via any suture, it forms the floor or articulation of lower teeth, which is called dental articulation. It articulates with the temporal bone via temporomandibular joint. It has landmarks showing fused parts indicated by notches. The body is the largest part of the mandible, which possesses the mental foramina laterally on both sides. Rami of the mandible are the second largest part of the mandible, which extends cranially from the angle of the mandible on both sides. They attach various structures to them, including Masseter muscle laterally and the medial pterygoid muscle and the sphenomandibular ligament to the medial side. We also have coronoid process, condylar process, and alveolar process, and they play a vital role as part of the mandible. We have many pathological conditions discovered within a mandible which cause pain and teeth loss. Some are alveolar bone resorption, tooth aplasia, and so on. Mandible is also a victim of fracture. These conditions can be prevented, treated, or diagnosed if necessary.